Right, well, I am Professor Jen Myers. I am sitting here with Ryan today. He's going to introduce himself, tell a little bit about how he moved through the kinesiology department in college here on campus, what he's currently doing for a position, and then we will have some rapid fire interview questions. Go ahead, Ryan.
Hey, so my name is Ryan Hronoski. I'm currently a cardiopulmonary rehabilitation specialist for Hennepin County Medical Center and Alina Health Services. Kind of how I essentially went through I went through the kinesiology program here at Concordia St. Paul. Decided that I really wanted to pursue more of a therapist type role in healthcare. But I also wanted to develop a role that, was outside the regular norm of things. And so I felt getting a degree through Concordia St. Paul, as well as pursuing cardiopulmonary rehabilitation, was the best way to do it.
And what were some of the classes that you would say were the most either beneficial or really helped kind of solidify your idea of, yeah, I want to go the rehab route?
So I think the biggest one is that, sorry. So essentially, I think the best one that really solidified it was the American College of Sports Medicine exercise prescription book that Concordia uses kind of throughout their program. And so reading it actually was probably the one thing that actually made me realize, oh, well, I think this is great. And they offer a lot of stress testing in there and a lot of other useful information that kind of led me more to, oh, well, I want exercise to be a little more than just external, but more internal.
Right. And so tell us how you didn't have the easiest, not path, but navigation maybe to actually even learning more about, your career field or the kind of subset of cardiac rehab, but within a larger healthcare field. How did stumbling upon that or doing your own research, what did that have to look like?
So essentially what I ended up doing was just the basic steps is that I wanted to see what was even out there. So I just checked resources like Indeed.com, try to do my best trying to weed out, the difference between an exercise specialist, personal training, exercise therapist. And there are a lot of other exercise physiologist positions even within the field, but they're not cardiac related. And so it was just like taking a spreadsheet and just trying to figure out what the requirements were and even digging deeper into what each job duty was. And eventually learning about requirements and what I had to do, which was also another intimidating factor. But thankfully, the field is relatively new where some of those requirements are more of a formality than actually required at this current time. So
Sure, totally. And you're exactly right about using the word exercise physiologist. I've seen that pop up in many different job descriptions or job openings, but it does mean different things, right? I mean, you can become a clinical exercise physiologist by taking like a, ACSM or NSCA certification. So I've had personal trainers who have tagged that on as more credentials for their personal training. Yes. Some people go and get a master's degree and they're considered exercise physiologists. So talk a little bit about that, because it isn't necessarily set in stone, right? So like you said, there's components of it, but it's not necessarily one definition fits all for exercise physiologist.
Yes. And so, I mean, my position could technically be called exercise physiology, but I think that in the realm, we're trying to separate each other a little more. That I found out, and there would be wonderful stories I could tell of the older exercise physiologists I work with, whether occupational therapists or physical therapists I actually currently work with, kind of explained kind of the changes in our career to become more cardio related. Right. So that was kind of a cool thing, in my opinion, to hear that story, but it's too much of a long-winded story to tell.
That's when our current students are going to reach out to me so I can reach out to yes. Ryan and hook them up directly so you can get your own personal version of that.
But essentially what I learned from it, and also I talked with the American College of Sports Medicine, I talked to NAMSA, I've talked to a lot of other different credentialing agencies to kind of get a better, broader understanding of what even their education requirements are, what each of their credentials matches what the job is. And so the nice thing about it is that a lot of them are really nice. They're willing to educate you and they're willing to just provide that free information. So that was kind of the biggest things. And then finding out, exercise physiologists are another special type of professional that essentially deals more with, some of them deal with more corrective exercises, some of them deal with performance enhancing or more along those lines. And so thankfully the American College of Sports Medicine just basically just kind of stated the clinical exercise physiologist was more for a more medical type of career choice. So
that makes sense. So speaking of career choices, tell us what you are currently doing. So you had some internship opportunities and then working actually in the Twin Cities area. And what does a typical day look like for you? And was it what you were expecting?
So thankfully it was everything that I was expecting. Cause I mean, I've watched YouTube videos to make sure this was something that I wanted. But so currently right now I work at Hennepin County Medical Center as kind of reiterating as an exercise physiologist or technically a cardiopulmonary rehabilitation specialist. But they have me in phase 1 training. So there's multiple different phases in cardiac rehabilitation. Phase 1 is essentially there's already been the event. They've had a heart attack, they've had a stroke, maybe a prolapsed valve, a multiplicity of different reasons. And so essentially it's my job to get up every morning. I have my patient lists and essentially I get to see what their conditions are, what their restrictions are. And I work with them to kind of gain some level of confidence and mobility. So some of it might be, I will be giving them education if they're bedridden, that they're just, they try to get out of bed. They just don't have the energy because you learn in anatomy and physiology that, oxygen is needed a lot for energy. And so it's, their heart isn't able to pump the blood to the rest of the body. So they get fatigued far, far quicker than you would think. So it's like they get out of bed and they're already out of breath. They're sweating. They can't handle the exercise. So you have to lay them back down. And so educating patients, but also making sure they're getting up, moving around, not just staying in bed all day. And depending upon procedures, if they have to go for an angiogram, maybe there's a heart replacement or valve replacement surgery, getting them prepared for that. So there might be stress testing involved. There are also alternative medicines that we have utilized, which I kind of was explaining to you and another student, that essentially it's just a big, there's 4 different blood pressure cuffs that essentially we place on the arms and legs, and it increases the pressure in the intercostal region, which actually promotes critical artery growth to kind of get over the occlusion that happened in one of the arteries, either the left or right arteries, or coronary arteries of the heart. And so that's essentially what I do. There are phase 2, which is a clinical setting, which they deal more heavily with, bikes and treadmills.
Right. With your duties, how much, so obviously things are pretty prescriptive and pretty standardized with, phase 1 and stepping down, right? Or stepping up. I guess, I don't know if they call it stepping up or stepping down into their next phases, but how much freedom do you have to make some decisions or recommendations, or is it pretty much by the book based on their stats? Is there some creativity? Obviously you have to have a little bit of a personality to get them to buy into it, right? So you're creating a little adherence, or hopefully bringing a little charisma to help them see that this is going to be beneficial for them. But do you feel like everything really needs to be quote unquote by the book, or is there a little leeway for you to finesse the situation based on people?
And so the best way to put it is that this is kind of where I think it's fun being a therapist, because a lot of the doctors will come to me and ask like, all right, well, how they're doing. And I mean, I have other skills involved that I have to have some EKG interpretation and understanding of that. So there are protocols in terms of making sure I'm not stressing the patient out to the point where they're having another heart attack.
Right.
And so it's just following, my protocols, but also at the same time finding different activities that a patient can do if they seriously cannot stress themselves to get out of bed. And so it's, finding other things that we can do to kind of work on building that heart, because there's some patients that their heart's not strong enough for a certain procedure and they have to stop because they're going to send the patient into another heart attack or another major problem. And so that's kind of what I enjoy about phase 1 in particular, because I have to be creative.
Right. And you're really probably one of the first faces that they see then, and a continuous, right? Like reliable face that's coming every day to really encourage and inspire their performance, hopefully, or in their recovery.
Yep. And that's the cool thing too, is that I see them every day and you build a really good relationship with them. And all of them are incredibly happy that you're there, because a lot of them either want to get out of bed anyway. And a lot of them can't leave the bed without, nurse supervision or someone being with them.
Yeah. I know we, due to patient confidentiality, I'm not going to ask you to share any names, but is there a patient or client that either pops to the top of your list because they were so enjoyable to work with, or maybe they were stubborn and you really had to put some elbow grease in, or what's a couple memorable experiences that you've had that you can share, with being pretty vague?
I would say one of my favorite interactions was that this individual had probably one of the worst heart attacks that I got to see. And HCMC has been one of the only places where I've seen a lot of bad cases. And so so there's a terminology where you'll learn ejection fraction, which essentially just states how much the blood is pumping, or how much the heart is pumping blood throughout the body. And so this individual had only 10% of its blood going to the rest of the body. So it was very, 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 very low. And kind of like I reiterated, the blood and oxygen to the body is such an important thing in terms of making sure the rest of the body is, receiving adequate perfusion. And if not, the muscles and just become fatigued and they just can't do their job. And so this patient I had to see this patient multiple times. And this was actually during my internship as well. And that eventually it's cool to see, at least as a therapist wise, is that you get to see the increase in the heart function over the time that you're working with the patient. So they will have a session with me, they'll go to echocardiographer, they will perform a test, and then they will determine the percentage of how either it's increased or decreased. And so this patient was, we even had to try to do just him getting out of bed, not even out of bed, just more sitting up and then sitting back down and sitting back up and sitting back down. And so just those small little changes, and even making sure they were eating by themselves continuously. And that slowly increased it to eventually we're like, all right, he's at 25%. All right, cool. We're making progress. 30%, 45%, and eventually reached to a more safer range of 75% after, I think it was 6 months.
Oh my gosh.
Yep. So it was almost close to the entire length of the internship. So.
And that has to be so our bodies are such fascinating machines, aren't they? And then for you to be able to say, this is what we're going to do, and here's the direct result. I mean, that has to be very rewarding to be able to, you watch them do it, and then you see the paper and pencil results or the printouts or whatever. It's like, okay, this was a direct response to the stimulus that we gave to the body. Wow.
So, and it was absolutely cool. I mean, obviously most patients like to come back, give a hug or something like that and say, thank you. And the family comes and brings you flowers and stuff like that. They're just excited that, hearing our dreaded kind of like, not a lot of patients survive this. And so we're not expecting a whole lot. And then eventually working with something that like is so intense and being like, all right, cool, we overcame this. So.
Good. That's what gets you up for work in the morning, huh?
Yes, absolutely.
Good. I want to transition back to, if we have current students watching this, thinking about where you came from and how you got there. What are a couple of things that you would tell to a current student or a student maybe considering a career like this? Things that you maybe wish you would have known when you were in the thick of things in school.
So number one thing that I wish that I knew, that what would have probably helped me or better prepare for this position, is that I really wish that I took a class in EKG interpretation originally. So, I mean, I'm a hospital taught EKG technician, as well as a hospital taught EMT, and multiplicity of other stuff I've done through the years. And so, I mean, I think that kind of gave me a better edge, but for students that don't have those particular resources that I had, being 10 years at the hospital, that being an EKG technician was the number one thing. Also knowing that there's many different organizations that will take that EKG tech experience to, cardiopulmonary rehabilitation specialist, type of experience as well. So that I thought EKG tech was all you did was watch a screen all day, which is partly true. but there is some level of patient interaction, and that there's actually multiple different things an EKG technician can do, which is stress testing. They'll just be supervised. Electrophysiology technician, which is essentially just being part of an angiogram procedure, and they're just watching the electrical currents of the heart while, you know, the procedure is going, and they will obviously inform, nope, the heart's starting to drop. We need to pull out. We need to stop the procedure, kind of thing. So there was a lot more that I wish I knew in terms of that. And I think that's the biggest thing. And that also, kind of wrapping it up too, most facilities will accept just an exercise physiologist certification versus the clinical exercise physiologist certification, because there is a requirement where there is a bachelor's degree requirement, and you need almost 600, or I think it's 1,200 hours, and no student's going to come out of that right from the get-go.
Right.
Even in my internship, I didn't barely even scratch that.
Right. Yeah, no, that is good things to think of. And if you are wanting to go in this direction, you do need to be committed then to
Yes.
making sure you get a few other outside opportunities in, for sure.
Yes.
Yeah. Okay. Final question for you. Where do you see this field going, or where do you see opportunities and options either for yourself, or, you know, what is new research showing, or what's the water cooler talk about new applications for cardiac rehab, exercise physiology? What are going to be the next steps for the next decade or two?
So essentially what I am starting to see now that I've kind of been in the field, and now I've been working under, you know, my head cardiopulmonary rehabilitation specialist, who she's also a researcher as well. And so a lot of it came from, I guess, to kind of give you a small history where it came from, you know, the term cardiac cripple, and that a lot of the older exercise physiologists, or the CPRs, basically said, you know, we came from them laying in bed and them unbuttoning buttons, and that was the only exercise we thought they could do, to reaching our point. But we have started to see that a lot of people are starting to go remote. So there have actually been job opportunities that I've been offered, and I've tried piloted for a little bit, which is you can sit home and essentially have a one-on-one discussion like this, just seeing how they're doing, making sure they're doing okay. And that seems a lot of the others that went that path really enjoy it because it matches their lifestyle. It's just kind of being more of a motivational speaker. But there are definitely other job opportunities out there. And I know that Lifetime is trying to develop a phase 3 program for cardiac related patients. You know, some have phased out, some want to bring it back, just because a lot of patients aren't 100% when they leave the hospital, and they're always concerned that, you know, potential inevitable things. So essentially those are the more things to look out for, is that they're trying their hardest to kind of bring back a lot of old or phase 3 programs.
Sure. Yep. So you would anticipate growth in the field, or, I mean, just with our aging population, right? It's a large percentage of our population. So this is going to be a career it's going to be in demand.
Yes.
Or it's going to be,
essentially, you know, the sad statistic is that, you know, a lot of people are actually, you know, suffering from a lot of cardiovascular related diseases. And so the demand continues to increase. And I mean, even we're considering hiring more, just because COVID brought it down to us only seeing about 4 patients, but usually we see about 8 to 10 patients in the clinic.
Yeah.
So it's just eventually, once everything kind of gets back to normal, it will.
Right. Yeah.
So,
yeah. And hopefully our students are being on the proactive side, right? And helping people discover healthy lifestyles before a cardiac event happens. But sometimes it's genetics too. But we also need people there on the other end, because we we know how hard healthy lifestyle and exercise adherence is for a majority of people. So we need to have some people to help pick them back up and get back on the train.
Absolutely.
Yeah. Anything else to add, Ryan? I appreciate your time today.
There's not really a whole much that, you know, in terms of adding, other than, you know, just the small little snippets of kind of like what I was, you know, wish that I was told and stuff like that. But additionally, just kind of keep in mind that it's still a growing field, and a lot of my a lot of my supervisors have kind of said that, you know, they've seen it from 30 years ago to where it is now, and that it's continually growing, and that there is a lot of research opportunities as well in cardiac rehab. And there's a lot of different labs that are looking for, people like us to kind of enhance the career as well. So I think that's the coolest thing about it is it's new, it's developing. There's a chance to do something really cool with it. So